everyone, and welcome to our discussion. I'm Katja Kletter. I am the marketing director here at Willo, and I'm so glad that you could join us for our discussion today about fluoride and why it matters and how we protect kids' smiles. Fluoride has long been recognized as one of the cornerstones, and it's also an important topic that continues to spark questions from parents, caregivers. So today we're going to talk about and unpack the science, the communication, practical strategies that can help you confidently navigate these conversations in your practice. We're lucky to be joined by two incredible experts in the field who bring both deep clinical knowledge and real-world perspective. Our special guest is Lisa Copeland, a registered dental hygienist, certified speaking professional, and a certified virtual presenter. Lisa is the founder of Communicate with Influence. She's a global speaker and how we like to refer to her as true Gen X powerhouse. Also a former Ironman athlete, and that focus and energy shines through everything that she does. She's passionate about helping families understand the why behind oral care, and fluoride is one of those topics that she tackles head on. And Lisa believes when we can communicate the benefits of fluoride with clarity and empathy, we can turn that into an opportunity for trust and confidence and prevention. So excited to have her here. And hosting this discussion is Dr. Joel Berg, board certified pediatric dentist, globally recognized thought leader in the industry with over 35 years of experience. He has served as the president of both the American Academy of Pediatric Dentistry and the American Academy of Aesthetic Dentistry. And we're proud to call him a part of the Willo team. He has played a pivotal role in the developing of the groundbreaking Willo toothbrushes for kids, which are true innovation in pediatric care. So with that, I want to give the microphone to Dr. Berg, who will be hosting this discussion. And Lisa, thank you for joining us.
Thank you, Katja.
Thank you, Katja, for that kind introduction. My pleasure to be here today and to talk to you, Lisa, who we've known each other for a long time, and you're a wonderful communicator. So we have only a short time today, about 20 minutes. So your effectiveness in communication will stand out today. Your book, Communicate with Influence, I think is appropriate because I think you will be influencing our audience today by your words. So let's get going. We're talking about fluoride today. It's part of a comprehensive prevention hygiene program for children in our case. Regarding the science of fluoride's been around for a long time, decades, half a century or more. We have various forms of delivery. We give fluoride varnish, we give rinses, etc. For children, perhaps it's hard to say what's the most effective because we have various forms of delivering fluoride, but talk to us for a moment to get us started, about the various forms of fluoride and what is the most important perhaps for children.
Mm-hmm. Well, as you and I both know, and the dental professionals on the call today, fluoride has just stood the test of time because it works. That's plain and simple. And as Katja mentioned, the AAPD is very influential in the guidelines. And we know now that topical fluoride is the gold standard for preventing cavities in children still to this day. And it's going to strengthen enamel. It helps repair early decay. And it also protects against those acid attacks that we have, like a roller coaster all day, every day. And so no matter what the form is, whether it's varnish or rinse or toothpaste, consistency, topical, consistent exposure is the key to really keep the smile strong and cavity free.
We hear about what I would call misconceptions about fluoride. A lot of things get into the public domain and the media, et cetera, et cetera. Parents, care providers have longstanding views, mostly very positive views about fluoride. Occasionally we get other views that come in. What are some of the most common misconceptions that one hears, and how should our listeners today address those misconceptions?
I think the misconceptions it's across the board. People just don't get the right scientific information. And it's really important, number one, to get the right amount of fluoride on the teeth if you're using topical, and that's really hard for kids to do. You know, they get either way too much or way too little, or it's everywhere in the bathroom but on the toothbrush. And so really understanding the amount of toothpaste, topical fluoride toothpaste should have in it. And then also learning more about the types of fluoride and how the different benefits occur. Because varnish that we apply in an office is very different than the toothpaste that they're using over the counter every single day. And so turning to your dental professional with questions and to get more accurate information, I think is the best way to get the right information.
So regarding the amount of fluoride, which is a really important point, you mentioned that the varnish that might be applied by your dental professional in the office is controlled in quantity by that dental professional. They put a precise amount on the brush, they brush it on, or perhaps in a tray.
Mm-hmm.
But at home with toothpaste, it's important, you're saying, that we pay attention to how much fluoride toothpaste our children
Right.
get. Yeah.
Right. And that's where Willo comes in. And I love this aspect of Willo. Either the autoflow or the brush bot, the toothpaste is actually delivering the exact amount of fluoride that you need. And so there's no question. It takes the guesswork out of how much are they putting on their toothbrush, how much are they getting onto the teeth. It removes that variable. So parents don't have to worry about it.
We often say when we talk about prevention, you and I have been talking about this for years. The elements of prevention are kind of three things, maybe more: diet, hygiene, and fluoride.
Mhm.
So the diet, what we consume, fermentable sugars, hygiene, brushing the teeth, and then fluoride, of course, all very important. As professionals, we know that consistent brushing is also important because we don't want the plaque levels to get too high, and they get so high that you can't manage it anymore. I always say plaque is like email, your inbox fills up and you delete it, and then the next day it's full of email again. And if you go on vacation, you don't do your email, you've got hundreds and you can't manage it anymore and it's done. It is kind of like that with plaque. Fluoride toothpaste is tied to brushing because the most common way we deliver it at home is with toothpaste.
Mhm.
So habit building, talk a little bit, please, about building habits that include the brushing and the fluoride as a combo toward preventing cavities.
Yeah. Fluoride toothpaste, I think of it as the everyday defender of a kid's smile, right? It's the superhero of oral care. It's going to strengthen the enamel, number one. If early decay starts, it will reverse that. And it's also going to reinforce brushing habits as a daily habit that is going to make a difference. So every time a child brushes with fluoride, they're building that consistency and the protection that's going to last not only in their childhood, but they're going to carry those habits through a lifetime and protect their smile and their teeth.
Lisa, I'm a pediatric dentist. I practice part-time, and throughout my career, all of us, especially those that are doing it every single day, and certainly the dental hygienists and the dental assistants who are chairside with them every day, they're hearing, the parents saying, "Can you please get my child to brush their teeth? They won't brush their teeth." And it really doesn't matter what they use. They can't, they don't, they won't
Right.
brush their teeth. And it's a struggle. There's this, we say brushing battles are real, that with parents and children. How can parents encourage independent routines? And what does Willo do in that regard to deal with that struggle that happens in the household every day?
Yeah. Well, to all the parents out there listening, you are not alone. Brushing battles are totally normal. I don't think I've ever worked with a parent that didn't at some point with their children have that struggle. Um, and you just nailed it, Joel. Independence is the secret weapon, right? You've got to enable the kids to have independence and let them take the lead. Give them choices, let them push the button on, and let them choose the toothpaste flavor, right? Give them some individuality and some customization that they can choose on their own. And that's going to help with the effort and take away the battle. So Willo just makes it easy, right? You've got different flavored toothpastes. Um, some have fluoride, some don't, which is a nice option. They also guide the brushing process automatically. And so every single tooth is going to get cleaned because it comes in contact with every single tooth, depending on the mouthpiece size that you choose. And then it turns the routine into something that the kids want to do, right? They actually want to brush, and they'll even go and brush on their own versus that, battle that we see as dental professionals all the time with parents and kids. It's just one less thing that parents have to think about.
But we say as pediatric dentists, as care providers for children, you make sure you supervise your child until they're 8 or 10 or something like that. But do we really know if they're brushing correctly? So what
No,
is it about the design of this product that will help the parents have confidence? And then on the child side, they want to please the parents. They want to do it right, but
right,
they feel frustrated. So how do you put all
right.
that together?
Well, part of the reason that kids struggle with getting the right amount of toothpaste is a lot of it is dexterity. They
Mhm.
just don't have the dexterity to put the toothpaste on. You get too much or you get too little, or and so the kids they don't have to think about it. The parents don't have to worry about it. Kids don't have to think about it because it's dispensed automatically in two different formats for them.
I was going to say, we often hear about children with special need with sensory issues, sensitivities, special healthcare needs. Brushing can be particularly difficult. What product characteristics or technologies will make a difference for improving compliance for these children with sensory issues?
Yeah, a big part of the practices I worked in, I worked with like a lot of the special healthcare needs children and adults. And one of the things they've really struggled with, not only dexterity wise, but they also struggle with sensory sensitivities, right? The sounds and the textures and the sensations, and it's too much for them sometimes. They can't even get the toothbrush close to their mouth because it's just too much. And so Willow it's so much quieter than so many of the other power toothbrushes. It's gentle. The motion of the toothbrush, they put it in their mouth and the toothbrush actually does all the work. So they don't have to worry about moving the brush around and, trying to get to areas where maybe they're going to gag from that. It takes those sensory issues and the triggers away. And so it's much easier for them to really brush all the surfaces of the teeth and know that they're getting a consistent, efficient brushing experience every time they're brushing. So it's less stress for them, it's bigger smiles for them and the parents, and you're going to have more routine with something that was very challenging to them before they had something like Willow.
We obviously, as dental professionals, we strongly recommend the use of fluoride in the various forms that you've described. We support water fluoridation, although not all kids get that. We
Mhm.
definitely support toothpaste with fluoride. We support the professional application of fluoride, usually in the form of a varnish. Some children need the additional support of a fluoride rinse, for example.
Mhm.
Um, so there are various forms and they're additive. It's not one versus another. So we do support that. In spite of that, as you referred to earlier, some, in spite of our advice, and parents have a choice, don't want to use fluoride. We say to them, we recommend it. However, we understand. We want to make sure you brush your teeth, and we control the diet and all those other things that are really important for as well. So, does Willow have a non-fluoride toothpaste as well as a fluoride?
They do, and it just came out, and I love it. They also have toothpaste without dyes in them now as well, which I love that feature too, because people want a choice, right? They don't want to be put into a
Hmm.
box and everybody has to do it. And so Willow does. They have a formula with fluoride in it, and they have a formula without, which is really nice, and it's made for both of the toothbrushes, which I love to be able to give my patients an option because not everybody wants fluoride, like you said, and they want to know why they should be using it, which now after this conversation hopefully people can take this information back and use it as leverage for helping kids reduce decay. But it's nice that Willow has those choices.
So, speaking of choices, you mentioned the BrushBot and the AutoFlow, and the BrushBot is the handheld version.
Hmm.
The AutoFlow is the one that's a little bit more sophisticated in that it completely automated because it injects the right amount of fluoride toothpaste, exactly the right amount, and then it evacuates it into the sink. So
My
we're
favorite feature.
yeah, it's a good feature, and we find it works with some of the kids with sensory issues even better,
Right,
perhaps. But
right.
um, so where can one go to find more information about the products? Those two can read about it, maybe see some videos, and also
Yep.
purchase it. Where could one go to do that?
Yeah, go to the Willow website and get all the information. There's great courses for dental professionals. There's great information. They also have an ambassador program if you're a dental practice and you're looking at selling it to your patients. But what I like about it is it's direct distribution. You don't have to carry the Willow products in your office. It's an online ordering and it's sent directly to the patient. So you don't have to manage that inventory. They also have information about the fluoridation versus the non-fluoridated products, but the Willow website's probably the best place. I believe it's available on Amazon through the Willow website and then the ambassador program.
Great. Last question for me, and we may have time to take some questions from the audience here. You said there were two kinds of toothpaste, like a liquid and a foam.
Mhm.
Can you explain that a little bit?
So the liquid is for the autoflow. It's a contained unit, and the liquid is actually part of the brushing experience. And it goes through the automation process and into the toothbrushes the children are brushing. And then the foam is actually for the brush bot, which is just a handheld battery operated toothbrush, and you squirt the foam into the brush and then you put it in your mouth. So a little bit easier. It's a little bit um, uh, less technology, but easy for portability.
Okay.
Portability.
Portability, yeah. And we say battery operated, you mean like rechargeable battery,
Rechargeable, yes.
charger and that kind of thing. Okay.
Yep.
Well, that's great. I love talking about prevention. I've done it for my whole career, and you've done a lot of that with me. So it's
Yes, I
glad
have.
to
I love it.
reconvene. We've been talking about this for years, and it's really the heart of what dentistry wants to do. And you're a dental hygienist, educator for a big part of your career, and I think
Mhm.
that this fits perfectly in this era to constantly improve the technology and the ways in which we can help, especially children, and because they suffer the most from not being able to do this correctly. So I'm grateful for
Right.
these innovations. Thank you.
And these conversations, I think they
That's
really
right.
help dental professionals to understand the technology and also to be able to pass that information on to their patients to improve oral hygiene.
So, Katja, I don't know, are we going to take some questions here, I believe, if there are any?
Yeah, thank you both for this very well led Joel or Dr. Berg discussion.
Always.
Uh, yes, and Lisa, thank you. I love some of the language that you used around fluoride being the everyday defender, and how Willow helps build independence. As always, we appreciate your point of view as a dental professional, seeing also the challenges. Out there in the real world and bringing your perspective as well.
My
Absolutely
pleasure.
value your perspective and endorsement. And yeah, certainly how to address some of the misconceptions for fluoride that exist out there. So with that, Dr. Berg, to your point, we want to open it for questions from the audience. And actually, as we wait, I did want to mention one thing. Lisa, you mentioned about where Willow is available. Yes, it is available on willow.com on our website, Amazon as well. So you can search for Willow toothpaste, and through dental professionals, we are offering it currently. There is actually a very interesting program that we offer to dental professionals. They can sign up to be our ambassadors, and what that means is they'll have a chance to earn extra income if you choose to recommend our products. And it's very easy. You don't need to carry the products in office. We provide materials to educate patients and their parents or caregivers. And if they're interested, they basically scan a QR code in the office, and that sale gets assigned to the particular office, participating office, and they get extra extra income from that. So really streamlined, really easy program for anyone that wants to get involved. And you can visit willow.com/dental professionals to learn more about the program. We're really excited to be offering that. But yes, those are the 3 places where we offer our products.
There's something in the Q&A I see. Let me look.
Yeah. What data is available in regards to outcomes? What amount of reduction in dental disease is seen?
Yes, thank you for the question. We have plaque studies, both internal and external, and as you may know, as you likely know, plaque studies are usually based on one-time brushing. They don't show the course of time. We have data recently also with reduction in gingivitis that we'll be talking about soon, and we have many other studies in progress. The product was just launched, so you have to do these studies with the launch product. But we also know, and I've done hundreds of plaque studies myself over the years with many products, that when you reduce the plaque, and if you're able to achieve that reduction every day, every single day in the same way for a long period, you will reduce um, gingivitis. Now, as far as disease, it's really interesting, and I don't want to get in too long of a conversation here, but in children versus adults, gingivitis is a very different thing. In adults, it often leads to periodontitis, and that's why you're concerned about it. So the outcome of gingivitis itself is a kind of not a predictor, but a step along the way, right? In children who don't have their teeth long enough in the primary dentition or mixed dentition, usually don't get periodontitis. So for them, gingivitis turns out to be a marker of long-term not brushing effectively, right? So for us, really, it is that marker along with use every day. So we're continuing to gather data about, because we know one-time brushing, we do great, much better than a manual brush. So all we have to do then is achieve that same result, using it every single day. So we're tracking it, stay tuned, we're posting lots of data online. And we realize that it's different with automated brushing that works because all we need to do is have them use the product and get that same reduction today, tomorrow, next week, a month from now. That's our objective. I hope that answers your question.
And Joel, can I now add on to that?
Please.
It it's all about consistency, right? And just if they're enjoying using the product and they feel like they're getting a better result because their parents are praising them and they're celebrating those little wins and they're doing it more consistently, you're going to see those results in, when they're coming in for their dental appointments, and you're going to see the results in how much easier the appointments are for the kids, right? And that translates into easier for the parents, which we all want that.
Yeah, that's right. I've been saying for a long time that toothbrushing ought to be easy. There are 2 parts, positioning the bristles and moving the bristles. And, any brush could actually accomplish those, but whether a child especially can do that. Can they position the bristles correctly around all those weird angled surfaces all around the mouth? Every tooth is different. I'm a big fan of the mandibular second premolar. Has a weird shape. I love the shape, but everyone's different. And can you wrap those bristles around there correctly and then move it correctly? It's pretty tough to do. It requires a lot of dexterity and skill and patience. And as we know, kids just don't have that patience. So we take that positioning part away, which is the hardest part.
Okay. Thank you, Joel. And actually, perhaps a question for you. A little bit about the mechanism of or mode of action, if you may, of Willow. How effective are Willow brushes at applying fluoride to children's teeth?
So those are 2 things. I'll answer the first part first. The mechanisms of action, when it was designed, we work with pediatric dentists, with hygienists, and with dental assistants, and with engineers. First, we looked at what is an effective way of brushing with a manual brush. And we've heard about this BAST technique for years, and people can debate what's the best technique, but you kind of have to make this sort of figure 8 around the teeth, and you know what I mean? So So we created a motor system that kind of moves. I'm using my hands for those who are watching, and it's not very good, but I'm kind of making that motion. And then the thing is, that motion is happening all around the mouth at the same time. So every tooth is getting that figure eight for the entire minute on one arch and the entire minute on the other arch. So, the positioning is key. And the motion is the right motion. We talk about small circles, right? The second part about fluoride dose is really important because, although the toothpaste and the auto flow, the fully automated version, could be used on its own, we designed it so that it's delivered into this system, and the system gives the exact right amount of toothpaste, and then it's evacuated down the sink. And the same thing with the foam version, as Lisa mentioned earlier, with the brush bot. You pump it a couple times and it delivers the exact amount of fluoride and toothpaste. They're together in the right amounts.
Perfect. Yes. And to Lisa's point, AutoFlow's feature of automatic dispensing is her favorite feature. A couple more questions. I've not been exposed to these products. I'm wondering if it tickles peds. Um, and
I could answer that. With anything new, when you're using this with tens of thousands of children, there are some they're going to say, "Oh, that feels a little different." But what we found that because we've chosen a motion that's not too aggressive, it's very gentle. We don't see that tickle too much. In fact, I don't recall seeing it much at all.
And
There
I
is the
haven't either.
ability to speed it up to a faster speed or a slower speed. So, but those are all features of the product. But the tickling thing doesn't seem to be an issue. And I'm not sure, how is this kept clean? So, like any brush, you have to keep the bristles clean. You rinse them. The good news about these products is, they're used within a family. And we also have a cleaning mechanism. There's a cycle for the
I
auto flow to clean it. That includes adding some hydrogen peroxide to disinfect, to keep the levels of anything that might grow in the bathroom. That happens with other brushes too. So we know the flowing of the system and the constant use will prevent that as long as the cleaning cycle is performed.
Yeah. Yeah. Every couple of weeks, there is an auto cycle being performed with, to Dr. Berg's point, hydrogen peroxide that you can be found in any pharmacy. And the brush head in of itself is soaked in hydrogen peroxide once a week. And that is all that is needed.
So Annette, hi. Thanks for joining us. I've used it. I'm super ticklish to power toothbrushes, and I've used it, and it didn't bother me at all, which I kind of was expecting it to. So that gives you a little bit of a guideline, but I haven't heard of any kids having that type of reaction to it either.
Yeah. And I think you used it because you wanted to experience what a
Yeah,
child might be experiencing. We've designed this for children. I would say, in fairness, you as a dental hygienist, I think you probably know how to brush your teeth, probably.
I
I'm
hope
just
so.
guessing.
But I have a really small mouth too, so the mouthpiece fit
Yeah.
me.
No,
It got all of my teeth.
it's good to know what others are experiencing. Yes, especially children.
So with that, I want to thank both Dr. Burke and Lisa for joining us today, and really giving us their perspective, real life number one fan. Yes, love it. Giving your perspective on fluoride, certainly on Willow brushes as well. Yes, as we would like to certainly state, this is a transformation in terms of how kids brush. And hopefully we talked through some of these key points. We would love to hear more from you. If you would like to book a demo or to learn more about Willow, please go on willow.com/dental professionals. There is a link there where you could book a demo. You get as part of that, post the demo, you get a free unit as well. So you can recommend our products, as well as if you are so inclined, you can also choose to participate in the ambassador program as well that we talked about earlier. So we would love to hear more from you. Appreciate everyone joining tonight.
Thank you. Thank you,
Thank
Katya,
you.
too.
Thank you.
Thanks.
Take care. Bye.